Hello guys, welcome to Rebuild Academy. My name is Adil Momin and I welcome you to the 7th part of our series From Virus to Vaccine, Let's Fight Infodemic. I hope you all are doing well, fighting pandemic as well as infodemic. But before we begin, let me tell you a very important point. It is extremely important and highly recommended to watch this series in order. Only then you will get a complete idea and a clear picture of every concept involved. The link is given in the description. Now, let's begin. In the previous discussion, we discussed in detail viruses and viral diseases, including the viral replication cycle, and we understood these concepts with the example of influenza virus. Right? Today, finally, we will start our discussion with coronaviruses. We will discuss the basic information, the structure of the virus. Then we will see the viral replication cycle of coronavirus. Furthermore, we will look into the chain of infection and some mutations of the virus. In addition to this, we will discuss respiratory infections and their types and specifically learn about pneumonia. In the end, we will discuss COVID-19, its symptoms and complications. Okay then, let's begin. Coronavirus is a family of viruses. Honestly speaking, the classification of viruses is a difficult task, even for scientists, so let's leave it for them. The name corona indicates the crown-shaped spikes on the surface of the virus. They are primarily present in mammals and birds, but they can mutate and cause infection in humans. Coronaviruses were first found in chicken embryos in 1937. An embryo is an early stage of the development of a multicellular organism. They caused bronchitis in chickens. Bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Bronchitis can also happen in humans. People who have bronchitis often cough up thickened mucus. Coronaviruses were first discovered to infect humans in the 1960s. It was found that they were cause of the common cold. The coronaviruses which can infect humans are called as human coronaviruses. There are 7 major human coronaviruses found till now: OC43, HKU1, 229E, NL63, SARS-CoV, MERS-CoV, and SARS-CoV-2. SARS-CoV is a coronavirus that causes disease, severe acute respiratory syndrome. SARS appeared in 2002 in China. It spread worldwide within a few months. Although it was quickly contained, no known transmission has occurred since 2004. MERS-CoV is a coronavirus that causes disease, Middle East respiratory syndrome. MERS appeared in Saudi Arabia in 2012. MERS-CoV is believed to be originally from bats. However, humans are typically infected from camels, either during direct contact or indirectly. SARS-CoV-2 is a coronavirus that causes the disease COVID-19, that is coronavirus disease 2019, in humans. We will shortly learn about this in details. Coronaviruses cause respiratory illness in humans. Especially they cause respiratory tract infections. It can range from mild illness like common cold to contagious infections like SARS, MERS, and COVID-19. I just want to highlight one point here. At the beginning of every video, I told you to watch this series in order. Now you can understand why. Because I have sequenced the content in such a way that you would not hear a word representing a concept which we have not discussed yet. For example, we have learned about respiratory tract, common cold, and zoonosis, so you can relate everything here. If someone of you who don't know these concepts will not be able to completely understand the discussion. Right? Another point that I want to highlight here, that whatever the discussion we are going to do regarding coronaviruses, especially SARS-CoV-2, based on scientific data available in the public domain till July of 2021. The topic is under research and highly dynamic in nature. So as the research progresses and the new insights and information comes, there are chances that our understanding regarding the structure and behavior of the virus will change accordingly. For example, scientists were not sure whether SARS-CoV-2 is airborne or not, but further research confirmed its airborne characteristics. Right, so keep this in mind. Now let's start with structure of SARS-CoV-2. SARS-CoV-2 is an enveloped RNA virus. Therefore, the genetic material inside the envelope is RNA, and there are three types of protein spikes on the surface of the virus. The membrane protein or M protein is responsible for the maintenance of the shape of the virus. The envelope protein or E protein are involved in the assembly process of the virus. Replication and spike protein or S protein are responsible for recognizing and binding to the target cells. So, these are major components of the virus. Now let's look into viral replication cycle of SARS-CoV-2. The first step is attachment. The S protein binds with ACE2 receptors on the cell and initiate the process, after which the fusion of the virus and the cell membrane occurs, which results in penetration of the virus into the cell. Then the enzymes do the job of uncoating and the viral genome is released in the cell. Since SARS-CoV-2 is an RNA virus, it does not travel to the nucleus of the cells but starts synthesizing the genome and proteins outside the nucleus. Then the assembly of the genome and proteins is done by packaging. The result is formation of new viruses, and these viruses leave the cell by gradual extrusion without cell lysis, and once the new viruses come outside, they start infecting neighboring cells. So this is the viral replication cycle of SARS-CoV-2. Now let's quickly look into the chain of infection of SARS-CoV-2. The infectious agent is SARS-CoV-2. The primary reservoir is bats, but it is also found in monkeys and humans. The portals of entry and exit are the mouth and nose, and modes of transmission include droplets and air. The elderly and people with comorbidities are more susceptible to infection. Now let's talk about mutations of SARS-CoV-2. Virus names and their associated diseases have frequently been named after geographical places where outbreaks were first reported or samples first isolated, such as West Nile virus or Ebola. They are also considered to be stigmatizing, but popular usage of the virus has frequently referred to place names, with early reference to SARS-CoV-2 as the Wuhan virus, with the discovery of important variants of the virus being linked to increased infectiousness. B.1.1.7 started to be known as the UK variant and B.1.351 as the South African variant, and India's Health Ministry, in the aftermath of B.1.617, that was popularly called the Indian variant, issued a press release decrying the media's use of the name, after which WHO has assigned simple, easy to say and remember labels for key variants of SARS-CoV-2 using letters of the Greek alphabet like alpha, beta and gamma. According to WHO, as of July 2021, there are 4 variants of concern. The alpha variant was found in the UK in September 2020, the beta variant was found in South Africa in May 2020, the gamma variant was found in Brazil in November 2020, and the 4th one is the delta variant, which was found in India in October 2020. And these are 4 variants of interest. Eta variant found in multiple countries in December 2020, Iota variant found in US in November 2020, Kappa variant found in India in October 2020, and the 4th one is Lambda variant found in Peru in December 2020. It is important to note that previously designated variants of interest or variants of concern, which has conclusively demonstrated to no longer pose a major added risk to global public health compared to other circulating variants, can be reclassified as alerts for further monitoring. Currently, there are 12 variants designated as alert for further monitoring, including 3 former variants of interest, and it is also possible that new variants will emerge in the future. Now moving to the next topic, let's start our discussion on respiratory tract infection. Respiratory tract infection can be classified as lower respiratory tract infection and upper respiratory tract infection. Upper respiratory tract infection is an infection in the nose, sinuses, or upper throat, whereas lower respiratory tract infection involves windpipe and lungs. Examples of upper RTIs are common cold, sore throat, tonsillitis, pharyngitis, laryngitis, and sinusitis. If these names might sound complex to you, but it is interesting to know if you add ITIS, that is itis, to the end of organs, then it represents the disease involving inflammation of that part. For example, if you add itis to the pharynx, it becomes pharyngitis, meaning inflammation of the pharynx. Similarly, laryngitis means inflammation of larynx. On the other hand, examples of lower RTIs is pneumonia, lung abscess, and acute bronchitis. Now you know what bronchitis is. It is inflammation of the bronchi. And in the case of lung abscess, cavities filled with liquid are formed in the lungs. It is important to note that most human coronaviruses cause upper respiratory tract infections in humans, but SARS-CoV-2 is found to able to cause both upper and lower respiratory tract infections in humans. Now let's discuss more about pneumonia. Pneumonia is an infection of lungs. This lung infection can be caused by bacteria or viruses. Therefore, pneumonia can be bacterial pneumonia or viral pneumonia based on the infectious agent. Streptococcus pneumoniae is a bacteria responsible for causing the most common bacterial pneumonia in humans. First, these bacteria get accumulated in the upper respiratory tract, then they travel to alveoli in the lungs and cause infection. This triggers the immune response as a part of the innate immune response when cytokines comes into action. There happens imbalance in cytokines, resulting in fluid leakage in alveoli, and they start filling with this liquid, which hampers their ability to effective gas exchange. This disturbance results in decreased oxygen transportation. Therefore, to get the required oxygen, the person has to breathe often, and this increases his breathing rate. Bacterial pneumonia can be treated with antibiotics. Vaccines are also available for protection against bacterial pneumonia. Now, if we talk about viral pneumonia, then generally viral pneumonia is comparatively milder than bacterial pneumonia, but it weakens the immune system, thus making the person with viral pneumonia vulnerable to bacterial pneumonia. Primarily, influenza viruses can cause viral pneumonia in humans, but adenoviruses and coronaviruses can also cause viral pneumonia. In the case of viral pneumonia, there is a chance of cellular destruction because we know that cell lysis is possible during virus replication, right? Now let's talk about complications of pneumonia. It is important to note that in case of pneumonia, early treatment is crucial because as the disease progresses, oxygen transportation problem becomes more severe. Therefore, it is always better to seek medical help if the initial symptoms show like fast breathing with cough, delayed care-seeking behavior, or poor access to hospital care, or both results in severe pneumonia. Talking about complications of pneumonia, it can worsen chronic conditions. For example, people with heart diseases, diabetes, or cancer, when getting pneumonia, can lead to more deterioration in their conditions. Also, pneumonia can become the cause of lung abscesses. Impaired breathing can also be a result of pneumonia, which then requires oxygen support. Pneumonia can also lead to bacteremia, where these bacteria enter the bloodstream, and if they start multiplying in the blood, then it is called septicemia, also known as blood poisoning. And to counter this, the immune system causes inflammation throughout the body. Severe cases of sepsis can lead to septic shock, which is a medical emergency. It can cause the failure of the respiratory system or multi-organ failure. Another complication of pneumonia is acute respiratory distress syndrome (ARDS), also called wet lungs. In ARDS, fluid collects in the air sacs of the lungs, depriving organs of oxygen. People with ARDS have severe shortness of breath and often are unable to breathe on their own without support from a ventilator. It is important to know that ventilator is a device that supports or takes over the breathing process, pumping air into the lungs, and it is different from simple oxygen supply. Now let's talk about COVID-19. We know that COVID-19 implies coronavirus disease 2019. This is viral infection caused by SARS-CoV-2 virus. As we know, COVID-19 can cause upper and lower respiratory tract infections. Therefore, its symptoms are diverse in nature and we are still not certain about all characteristic symptoms of COVID-19. For our understanding, let's divide them into three major types as respiratory symptoms, musculoskeletal symptoms, and digestive symptoms. Respiratory symptoms include cough, sputum, fever, and shortness of breath. Sputum is produced when a person's lungs are diseased or damaged. Sputum is not saliva, but the thick mucus, sometimes called as phlegm, which is coughed up from the lungs. Musculoskeletal symptoms are those symptoms involving bones, muscles, tendons, ligaments, and soft tissues. They can be muscle and joint pain, headache, and fatigue. The digestive symptoms include abdominal pain, vomiting, and diarrhea. Initially, the major focus was on respiratory symptoms, but later research proved that half of the people who were COVID positive reported digestive symptoms as well. Loss of smell and taste are also COVID-19 symptoms. It is believed that these are neurological symptoms of COVID. Now, before talking about COVID-19 complications, let me mention a couple of points here. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment and hospitalization. Therefore, it is highly recommended getting yourself tested if you have any symptoms, and even if you are positive, it is highly likely that you will recover without any complications if you take timely medical advice and treatment. The purpose of discussing complications here is for awareness purpose and not to scare people. So the possible complications of COVID-19 include severe pneumonia, ARDS, septic shock, acute liver injury, acute cardiac injury, blood clots. COVID-19 can also cause secondary infections like multisystem inflammatory syndrome and mucormycosis. MIS is a rare but acute condition associated with COVID-19, where different body parts can be inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. MIS can affect both children and adults, but in case of COVID-associated MIS, it is reported to affect children more. Another complication is mucormycosis, popularly known as black fungus. It is a fungal infection. People with diabetes are more susceptible to black fungus. We will discuss more of this in upcoming videos. So this brings us to the end of today's discussion. Now, as usual, let's quickly revise the topics we discussed today. We started with the discussion on coronaviruses. We learned about their discovery and human coronaviruses, including SARS and MERS. Then, after briefly discussing the structure of SARS-CoV-2, we saw its viral replication cycle. We also touched upon the chain of infection of COVID-19. Then we talked about different variants of SARS-CoV-2 and how their naming scheme has evolved. We saw 4 variants of concern and 4 variants of interest till now, and also 12 variants under alert for further monitoring. Then we discussed respiratory tract infections, that is RTIs. We learned upper RTIs and lower RTIs, after which we talked about pneumonia specifically, and then we saw complications of pneumonia. And lastly, we discussed COVID-19, different symptoms of COVID-19, and then complications of COVID. We also learned most people with COVID recover without special treatment, and timely medical care is crucial. In the upcoming video, we will be discussing diagnosis and methods of diagnosis, particularly in case of COVID-19, like RT-PCR and rapid antigen tests. So, make sure you subscribe the channel and press the bell icon for timely notifications. If you enjoyed and learned something from this video, then ensure that you like the video and share it with others so that we all work together and battle the infodemic. If you have any suggestions, you can comment below. That's all for now. We will meet in the next video. Stay safe, stay connected.